Hi, this is Andrea Kane, and I'm here with you for HIT 352, Health Information Systems. We are getting started with Chapter 1 for Week 1, and this is Introduction to Information Systems for Health Information Technology. If you want to pull out your textbook and follow along with me, we'll start on Chapter 1. Our learning objectives, at least according to the book, are to identify and discuss the impact of computers on healthcare, discuss the history of computers in healthcare, compare and contrast the similarities and differences among the internet, intranet, and extranet as used in healthcare, and explain data analytics and health informatics and how information systems, or IS, apply. So let's look at information system. What is it? It's an automated system that uses computer hardware and software to record, manipulate, store, recover, and disseminate data. Technology changes rapidly, as we all know, and skills and knowledge require updating. What is data? Data are raw facts and figures. Please keep that in mind. Data is not information. Data is just raw facts and figures. History of computers in healthcare, early systems. The earliest systems were financial applications and mainframe computers. In 1960s, you had punch cards and mainframes. In 1970s, you had dumb terminals, and PCs, or personal computers, started on the scene. In the 80s and 90s, you had the internet, wired networking, and new data entry methods such as barcodes, speech recognition, touch screens, light pens, and microphones. We now have wireless devices for point-of-care, computers on wheels, and things like that, as well as an electronic health record, which is an electronic record of health-related information on an individual that conforms to a nationally recognized interoperability standard and can be created, managed, and consulted by authorized clinicians and staff across more than one healthcare organization. Please make sure you know that definition. Cloud computing is the delivery of computational services like analytics, storage, and application sharing by a vendor over the internet. An intranet is a private information network that is similar to the internet in that it uses internet technologies. It hosts policies and procedures, forums, events, things like that. An extranet is a system of connections of private internet networks outside an organization's firewall. It uses internet technology to enable collaborative applications to allow external users to access the information system without using their real system. Impact of computers on healthcare. Computers are now used for patient care, research, business practices, education, public health, and a million other things. When it comes to patient care, we are using the impact of computers definitely is part of the actual care provided to the patient, patient engagement in healthcare. You think of patient portals, creation of evidence-based medicine, creation of practice guidelines, and patient safety. Health information exchanges are an exchange of health information electronically between providers and others with the same level of interoperability. This visual is really hard to see. I think it's better in your book, but it's basically showing you that in a health information exchange, different healthcare providers put information into the exchange and pull it out. So going back to impact of computers on healthcare when it comes to patient care, patient safety, and this is in your book. To Err is Human, Building a Safer Health System was published by the Institute of Medicine in 1999. And that report was really eye-opening to the healthcare industry, seeing that there were so many patients dying from preventable medical errors. Out of that came the push for an electronic health record to eliminate illegibility from handwritten entries, ensure complete information, and to create clinical provider order entries so that orders were done electronically, meaning that they were available at the right time to the right people, and again, it eliminated that illegibility issue, and they could be checked. There were more opportunities for it to make sure that the right orders were being given. When you think about drug incompatibilities, you think about drug allergies and things like that. CPOE was created to take those into consideration and prevent those from continuing. Also, evidence-based medicine, and this is based on peer-reviewed studies, clinical pathways, clinical practice guidelines. Health informatics is a science that defines how health information is technically captured, transmitted, and utilized. Knowledge, information processing, and communication are all part of health informatics, and health informatics are used in healthcare practice, education, and research. Data analytics is the science of examining raw data with the purpose of drawing conclusions about that information. And there is a certification where you can become a certified health data analyst. So let's talk about data versus information, because I told you earlier, data is not the same as information. Data is raw pieces of facts, raw facts. So for instance, if you're looking at data, you may see 90% of the patients have insurance. Where it becomes information is looking at that data and finding out that 33% of the patients have commercial insurance, which is a 2% increase over this point last year. Knowing that 90% of your patients have insurance, that's just a fact. It doesn't necessarily mean that there's anything there to be acted upon. But when you look at it as information where you see, oh, it's a 2% increase over this point last year, you can see that that is something that you might be able to utilize to make a decision or act on. There are 4 categories of data analytics. There's descriptive analytics, diagnostic analytics, predictive analytics, and prescriptive analytics. So your book does a really good job of going through what each of these are. Data mining is extracting and analyzing large volumes of data from a database for the purpose of identifying hidden and sometimes subtle relationships or patterns and using those relationships to predict behaviors. And do you know who the master of data mining is? It's the federal government, specifically the agencies that work to detect fraud, abuse, and waste. They are constantly going through large volumes of electronic data submitted from healthcare organizations and identifying those relationships and patterns to identify potential issues that could result in allegations of fraud or abuse. Dashboards are reports of process measures to help leaders follow progress to assist with strategic planning. They include key measures and graphics. And I think they're going to give us, yes, okay, they give us a sample dashboard here, and this is very hard to read. And I looked at it in your book, and it's not much better in your book, but I'm sure at some point we'll be able to look at an example of a dashboard in terms of maybe our EHR Go activities. So let's talk about data analytics and look at tools. Descriptive statistics are statistical information that describes the characteristics of a specific group or population. Inferential statistics are statistical techniques that allow researchers to make generalizations about a population's characteristics. So notice they're a little bit different. One is information, one is a technique. One describes the characteristics of a specific group or population. The other one is making generalization about the population's characteristics. Predictive modeling is a process that's used to identify patterns that can be used to predict the odds of a particular outcome based on the observed data. So predictive modeling is different than inferential statistics. Make sure you know the differences between these 3. Looking at the HIM profession, we have had a huge impact when it comes to computers in our activities. We now utilize technology for assigning diagnosis and procedure codes, managing the master patient index, managing registries like cancer registries, trauma registries, birth registries, all sorts of registries. We use it for transcribing documents such as the discharge summary, front-end speech recognition versus back-end speech recognition. There's analyzing the health record that's now electronic, documenting release of information, and accounting of disclosures activities, as well as computer-assisted coding. When it comes to the HIM department, computers have enabled us to work virtually with increased productivity and increased employee job satisfaction. They have allowed centralized departments to come into being. The first centralized department I was involved in was approximately 30 years ago. There are great advantages to centralized departments. There are a handful of disadvantages, and I would argue that the advantages far, far outweigh the disadvantages based on experiences I've had on both sides of the fence. However, computers, as we utilize them and their technology, they require changes in our skills and changes in our roles. And that is it for Chapter 1. I will be back shortly to talk to you about Chapter 2. Thank you.